I'm Jordan Fondo, and I'm an exercise science major going for physical therapy, and I'm going to talk about how to rehab your knee after having an ACL injury and going through surgery. Throughout high school, I played football, basketball, and track, and I had to go to physical therapy for a few minor injuries, and I think that's where I got my interest in physical therapy. My senior year, I tore my ACL playing football. I had to do a lot of therapy before surgery and after surgery, and I'm going to go through a few of the details of the exercises I had to do to get back on my feet. After reconstructive knee surgery to repair your ACL, therapy will be necessary for joint mobility and to stabilize your knee and to make sure the anatomy returns back to normal. Therapy for this type of injury usually lasts between 12 to 14 weeks, and during these 12 to 14 weeks you want to regain balance, range of motion. Flexibility is something you got to work on throughout the entire 14 weeks, and then towards the end you really start working on strength gains so that you can return to normal and that your knee will be completely stable. Right after surgery, what you want to do is elevate your knee and your whole leg as much as possible. It reduces swelling, and also you want to ice very often because it also reduces swelling, and swelling is what causes the majority of the pain. Now, as far as the exercises go, there are many different exercises that you'll do throughout the 12 to 14 weeks of therapy and during rehabbing your knee. So I'm just going to demonstrate a few right now. You typically do these on a platform or a table in the therapy room, but I will just improvise by doing these on the floor right now. At the very beginning of therapy, you'll be limited on the exercises that you can do, and that is frustrating for some people. But what you're going to do first is quad sets, where you just squeeze your quadricep as tight as possible. It helps with the extension of your leg, and it works on tightening and the regaining of the muscle because you will have muscle atrophy. And also you'll do that on your right leg, your good leg, also, or whichever leg is your good or bad leg. You also want to do it on your good leg so that you can keep your body symmetrical. Also, as you go along throughout the 12 to 14 weeks, you'll be doing a lot of straight leg raises, and you can also do these with ankle weights, but you'll lay down on the platform on the table in the therapy room, and you'll raise your leg, and you'll do 3 or 4 sets of 12 to 15, and you'll also do that on your good leg too. You can also do heel slides, and you'll do this without your shoe on and with a sock on, and you'll just slide back and forth, and that's for range of motion, and it's helping your muscles to regain that muscle that you've lost. You'll also do hip abduction and adduction, where you do like up and down right here, and you'll also do that, and you'll do that on both sides. To regain balance, you'll also just stand on one leg for a period of time, and the therapist will work with you and give you different places to reach or to touch, or you'll do ball tossing while just standing on that one leg, and you'll also do that on your good leg too. You'll also do plenty of hamstring exercises, stationary bike, and all these exercises progress and get harder as you go along with therapy so that you can regain your strength. As all your exercises are done through this type of recovery, the therapist will record all your progress and make sure that he changes all the exercises and activities if needed to help make sure that you are progressing and gaining all your strength back so that you will be able to function without pain. And so far this has been an overview of all the many things that you will have to do if you ever do have to recover from an injury like this. So I hope this has been helpful, and Kines 205, this has been how to rehab your knee after having a torn ACL.